If you have a short amount of time to spend with a patient and you sit down, it actually increases the perception that you've spent more time with them. So it's even more beneficial when you don't have time to sit down rather than just standing at the door, like slowly backing away, inching away. Yep, yeah, sure. I'll be right back. Like, not really good for patient care. Welcome to Patient Satisfaction 101. Hey, what's up guys? My name is John and I'm an emergency medicine physician assistant, but the tips and tricks that I'm going to be sharing is relevant whether you are a doctor, a PA, an NP, a nurse, anyone that comes in contact with patients. I'm going to share the secret of patient satisfaction, and this is coming from a guy that once upon a time had a 97% press-ganey score. I just want to get this out of the way early. This is not a video about practicing bad medicine, but it's okay because the patients love you. It is also not a video about giving narcotics to drug seekers or giving antibiotics to people with viral illnesses so that they are happy and, everybody just moves on, kumbaya. This is a video about actionable tips on how to get really good patient satisfaction. I'm going to kind of start off simple, kind of the backbone of good patient satisfaction, having a good first impression. So that means introducing yourself in a nice, kind manner, being presentable, having a nice smile, making good eye contact. These are all very important. Are you standing up tall? Are you looking confident? Or are you there kind of all closed off? You're hunched over. You don't feel like you want to be there. You definitely look overworked, like you've been lacking sleep. These are kind of things that your patients definitely take account of the first few seconds that you walk through the door. With COVID-19 and everybody wearing masks, something that I've done is I've started to wear a floral cap, and it helps brighten up the mood a bit. Nice atmosphere, cheery atmosphere, even though you are in a dark, dreary, fluorescent light bulb emergency department and you might be having a medical emergency. It is a little thing that can go a long way. I think that an introduction should be clear and concise. This goes on to my second point, which is actually listen to the patient and the patient's concerns. So there's some sort of study or factoid where they said that, doctors and medical providers will cut a patient off within the first 12 seconds. What I like to do is at least give the patient a good minute or two to tell me what is on their mind, to just get started and tell me why they're here. So I leave it very open-ended and I want to hear what they have to say. Obviously, if the patient starts, well, this one time back in 1937, listen, I'm in the ER. We're busy. There's a lot of things going on. I'm not saying that you let the patient ramble on for 10 or 20 minutes. These patients come in, whether they've waited for several hours, whether they've waited days or weeks to talk to somebody about their medical problem, they want to be heard. And so give them that chance to feel like they're being heard. Another thing that's super useful in the emergency department or a setting where patients do have to wait a decent amount of time to see you is to acknowledge the wait, especially if it's a long wait. You don't necessarily have to apologize for the wait, because apologizing means that you maybe had some sort of relationship to how long they've waited. And I have no bearing on whether a patient waits 10 minutes or 3 hours. The wait oftentimes is not in your control, but acknowledging that the person was waiting, that their time is valuable, I think that definitely goes a long way towards setting the patient encounter into the right sort of space. And because I don't want to waste your time and you don't want to waste my time, and everybody is sort of respectful of that. Patients have a lot of other things going on. They have jumbled up their life to be here to talk to you. So acknowledge that. Acknowledge that, it does suck. Another tip to help the patient sort of feel like they are being heard, other than just acknowledging their wait and not interrupting them right away, would be to sit down. And they actually show that sitting down increases the perception of spending more time with the patient. And I get it, especially when patients are going to be in the department for half an hour, 2 hours, 3 hours, and you give them all of 30 seconds of your time. It's not a good way to create good patient satisfaction. A little gesture, such as even just asking the patient if they want a warm blanket, especially if you know that they're going to be in the department for 2 or 3 hours. Even if they deny it, it's a thoughtful thing. It's like, oh yeah, he actually cares about my comfort while I'm here in the ER. Even things like, would you like something to drink? And the patient can actually eat and drink in the department. They don't have some surgical issue going on. Things like showing them where the call bell is, or showing them where the TV remote is, or, just asking if there's anything they need, if they need to go to the bathroom. Takes you 2 seconds to ask. For patient care, I think it's very important to understand the patient's motivations, the patient's fears. What is the patient trying to get out of the encounter? Because if you try to get to the bottom and understand why they're in the ER or why they're in your clinic. It makes the whole encounter a lot better. It makes everything go a lot smoother. So get to the bottom of their intentions. Sometimes their intention is really just, I have a lot of pain and I want, pain medication. Sometimes their intention is they feel really ill and they can't go to work and their boss is harassing them and they just want someone to acknowledge that they're sick. Another thing to helping meet those expectations is to under-promise and to over-deliver. Something as simple as a patient will ask you, how long does it take to get a CAT scan? And you know that in your department, from order time till the time it is read, it might take like an hour. Tell them that it'll take 2 or 3 hours. That way, they might not be thrilled about that when you tell them that, but then when they go through the rigmarole and they have their CAT scan done in 25 minutes and you're telling them about the result at within an hour, you exceeded their expectations. I think what's important is setting good expectations. So if a patient comes to the ER and they're complaining of knee pain, I've had patients come in demanding that they want an MRI of their knee on a weekend. That's not really going to happen today, but we can do XYZ. It helps with the patient satisfaction a little bit to explain your thought process, explain your plan, and make sure that they're on board with your plan, because people don't know the process. You are the supposed expert in the specialty or area that they're coming to seek help from. You do this almost every day of your career. They are seeking care, once or twice or a few times, handful of times. So a lot of people don't know the system, and if you can explain the system, sort of the emergency department or your clinic or your urgent care can offer and do for them, then I think that definitely goes a long way in patient satisfaction. Make sure the patient's engaged, involved with their care, but not just the patient. There are oftentimes patients that come to the ER or clinic with a loved one, a family member, a friend, and they do want that family member or friend involved in their care. There are patients that might not be able to take care of themselves well, or the patient's not really too concerned about an issue, but the family member really is, and they were really the reason why the patient came to seek care that day. And so by flat out ignoring a loved one or a friend or whoever the patient decides is important enough to bring with them to their encounter for comfort, for, help outside of the ER or outside of your clinic, I think it's very important to, yes, you are dealing with the patient, you are making eye contact with the patient, acknowledging the patient's needs and concerns, but it is appropriate too to, go over to that loved one, acknowledge them, give them some eye contact, ask them an open-ended question, goes a long way for patient satisfaction and patient care. Going in to the ER or going into your job for the day and kind of zoning out sort of the other things in your personal life. It's as simple as being nice is very easy to do. I feel like for me, it takes a lot more effort to be rude to somebody, and I've definitely had times where I don't necessarily mirror what the patient is doing. Obviously, if the patient is nervous or not forthcoming, I'm not going to mirror those sentiments, but I'll be understanding. If the patient is angry at you or screaming at you or threatening you, you're not angry or screaming or threatening them back. There's no purpose to that. You won't believe how many times, though, as the patient encounter is ending, I've had patients come up to me and apologize for how they were behaving, for how they were feeling because of XYZ reason. It is not, as I say, my medical emergency, it is theirs. So at a minimum, though, I can be understanding and respectful and kind. And I think that definitely goes a long way in making patients love you and appreciating your care. Little things like small talk or cracking a joke here or there. And I'm not saying that you have to be a gesture. We had a ER tech in our department. Shout out to you, Roger. I know you watch the videos sometimes. Everybody loved him. Everybody from the staff to the patients. He essentially made the whole department better, and he raised up the department because of how he acted and his mannerisms and the fact that he would just be so friendly and, talk and small talk about their family, about their friends, about events. That sort of thing elevates everybody else. It elevates all of our moods and makes us all be better. But even if someone might have had like a little bit of a bad encounter with one person, the lump sum overall experience was positive, and that reflects back on you. I'm going to tell you guys that regardless of following all these tips, you will not hit 100% patient satisfaction. I've seen thousands of patients, and you cannot please everyone. There will always be 1 or 2 people that no matter what you do, they will not like you. You're not out there to get 100%. I actually even remember there was an ER encounter. I did everything I usually do. I smiled, I went in, I sat down, I listened to her concerns. We ran all the tests. I explained why we were running the tests. I went back into the room I explained that everything was A-okay, and I gave them actionable steps about what to do after they left the department. It was a pretty nondescript encounter, and it wasn't even like we were busy, so I felt like I could spend a little bit extra time than I usually do to make sure that this person understood what was going on. The nurse went in with the discharge papers, and she was in there for 10 minutes. She told me doing damage control because this patient called me a condescending asshole. And to this day, I really don't understand why I was called that. I've also had patients who didn't get their way complain to my boss with false statements. I've had false Google reviews written about me saying that we didn't run tests that we actually did. You will not get 100% patient satisfaction. There is nothing that you can do to make sure that everybody's satisfied. If you have any more tips, tricks, comments, leave them in the comment section down below, guys. I'd love to hear what you guys are doing. If you found this video useful, hit that like button down below. Check me out on Instagram. And as always, guys, stay safe out there. Have a great rest of your day. Bye-bye.